Cardon Children's Medical Center, providing comprehensive pediatric care for Arizona's families.
My role is to make sure that the children that come here have the very best pain management possible. If we're going to do something that would inflict pain, like an IV start or a shot of some type, that we would do everything we could to make sure that they didn't feel that.
Children go to doctor's office and get immunizations all the time, and I think they hurt, kids think they hurt, and that's what they think when they're coming into the hospital here, is that they're going to hurt like at the doctor's office and for days afterwards.
And if we're going to do something that is going to be painful in the end, like surgery, where we know there's going to be pain after, then we're going to do everything in our power to control that and manage that pain. And that doesn't mean just giving a boatload of drugs. That would be also utilizing the child's own strengths and coping skills to help them manage their pain through hypnosis, massage, and other modalities.
Pain is really important to control when they're in the hospital. Kids need to continue to develop, and the more they lay in the bed, especially younger kids, the more that their developmental milestones are going to be set back. For parents who are taking their children to their physician's office, they can talk to them about, if they're going to have routine immunizations that day. I mean, usually parents know if they're going to get immunizations, and if you don't know, you can always call ahead of time and prepare the child beforehand. Some things that work are, while the child's getting immunizations, is ask if they can put ice on right before, just ice from a freezer.
A venipuncture to them is just another shot. And venipuncture is when you enter the vein with a hollow needle and leave a straw in the vein so that we can deliver medications and fluids. We can use a variety of different creams that have lidocaine in them that can take 30 to 60 minutes to start working. And the depth at which they work is not as deep as some of the other things. We also have this stuff called what we call freezy spray, which is just a refrigerant spray where it cools the skin down really quickly. That doesn't last very long, so you really have to be kind of Johnny on the spot. You spray and then you stick. And some kids find that kind of painful in and of itself because it's very, very cold. And then we have another modality that we have introduced recently in the last year called the J-tip, which is a needleless injection device. This is the J-tip. This is the CO2 cartridge that propels the lidocaine that's in the syringe into the patient. This little thing is the trigger, which will activate all that, but right now it has a trigger lock on, so we're going to remove that trigger lock. And now we're ready to activate this. We're going to clean up the patient and then remove the cover and put that against the skin, and then we're going to activate it. And then in 3 to 5 minutes, the child will be numb and won't feel the venous puncture. We've even started IVs on sleeping babies in our emergency room. What they do is they cover the child's ears so the babies don't wake up, because the J-tip can be a little bit noisy. With the baby in the parent's arms, they're able to start that IV or draw that blood with the baby never waking up, which is just awesome, totally awesome.
I go into a room and just engage the child first. Also asking just questions about what they like to do, what they're going to be for Halloween, what they want for their birthday. Just establish rapport with a child first before even explaining anything about the hospital.
One of the myths about children in pain is that they forget. And we know now scientifically that their bodies don't forget. Their pain pathways will actually create new pain pathways if they experience painful intervals over and over again. Their body will realize the world's a painful world, and so it needs to be aware. People think that with little kids who can't speak, that they forget what we do. My son, when he was little, had bad ear infections. and he basically lost his speech because of the ear infections. And he was 15 months old, got his second set of tubes. At that time, we didn't have parent present at induction. I couldn't go back with him to comfort him or anything like that, and he went back there. He had memory of what went on, and as he gained speech over the years, he would tell me more and more about what happened back there. Now, this has more to do with memory than pain, but they took him back, they taped his head to the table, they taped his arms down, and then, in his words, held something over my face so I couldn't breathe. Well, that's the anesthesia to put him to sleep, and they were doing the very best job that they knew how to do at the time, because this is many years ago. And they thought at that time kids don't remember. But he remembered, and he, to this day, it's very difficult to get him to go get his flu shot or go get his dental work done or any of those kinds of things, because he just doesn't trust.
We always like to tell children that they're being brave, be a big boy, be a big girl, you don't need to cry. The way I kind of look at it is, even if they don't cry and you tell them, oh, you're so brave, maybe they're not brave inside. Maybe they are really having a hard time with it, but they're being so stoic. So I always tell the children, you did a great job. You did perfect. Find something good they did. If they have good lungs and they screamed really loud, tell them they have great lungs and they're a good screamer. Just find something, find the positive in the whole situation.